So we will resume our day of presentation and discussion of the achievements of results of the EU-JAV. And now we will have the team who are focused on vaccine supplied and EU-wide anticipation and preparedness. And for this, I will leave the floor to Karianne Johansson from Norway, Antonietta Filia from Italy, has heavily participated to this team, to this achievement, but she could not be there today.
Yeah, I will use this one. Thanks a lot. And good day. So I will cover the talk on the work package 6 on vaccine supply and preparedness. And basically this work has been taken up by two teams, the Italian National Health Institute and the Norwegian Institute of Public Health. And the background for vaccine supply and preparedness, and you must remember that this was really back prior to the COVID-19. It was back in 2018 and 2019, and COVID-19 vaccines and the purchase mechanisms we had didn't really exist. But still, vaccination is one of the most significant public health achievements, and thus national immunization programs really depend on adequate supply of high quality vaccines. So vaccine shortages then will be a very serious public health issues, as they can lead to missed opportunities for those who are going to be vaccinated, and also a greater risk of occurrence of deadly vaccine preventable diseases. The slide deck, which I'm covering today, is quite comprehensive, and also there are a lot of reports which have been published on the European Joint Action webpage. So I really recommend you to read them fully and truly on the webpage. But I will highlight some key topics and maybe also focus more on the recommendations and the future outlook in terms of the experience we now have with the COVID-19 vaccines. But the work package was divided in two different tasks. The first one was to look into mapping vaccine needs and demands. And that was the Italian team that looked at shortages in Europe. They also looked into financial mechanisms for vaccine procurement, and also looked into what kind of guidelines or procedures did the national institutes or the public procurers have in place. And the other task was led by the Norwegian team, and we wanted to look into, in case there is a shortage, if you need to really exchange vaccines quite quickly with another member states, what kind of tools would be useful, what kind of mechanisms could we use? And then we also wanted to ask the question to the member states if they wanted to have like a data warehouse to review all the supply in Europe, if that would be helpful in case you needed to exchange vaccines. So the first task, the methods, I think we used basically the same type of methods. We did a lot of surveys, and we also did literature reviews, and we also used the meetings which took place, and also workshops with some selected stakeholders. The first results from the Italian team, they looked into shortages, and this is back in May 2019. I think the review they did was from 2016 to 2019, so they covered 3 years. But back then, it was 28 countries which they surveyed, and 21 of them responded, and 19 of the countries actually said that they had experienced at least one shortage in their immunization program. And the median duration of the shortages was 5 months. And 6 of the countries back then reported ongoing shortages. And if you look to the map it's on, at least on my right side, it's probably on your right side as well, you can see that by the color that some of the countries experience more shortages than others. Italy, for instance, France, and Greece and Latvia back then. And the vaccines in the schedule affected by shortages was the diphtheria and tetanus containing vaccines, hepatitis B and hepatitis A. And the most commonly reported causes of shortages was production issues and global shortage. And this really also reflects the fact that vaccine production today is global. There are very few suppliers and they are manufacturers of a large scale. And also some pointed out that it was a higher than expected demand, which reflects back to what kind of forecasting procedures do the country have in place to expect what is the need. The Italian team also asked the impact of shortages on vaccine services, and some of them said that they had then to use alternative vaccines to temporarily change the immunization schedule. And they also asked the stakeholders' views about this shortages, and their feedback was really that timely communication between supply and demand is really fundamental to avoid and mitigate shortages. And these results have now been published in the Vaccine Journal, actually February this year. The second results from the Italian team, they looked into financial mechanisms for vaccine procurement. What kind of financial mechanisms did the member states view and their opinion on that? And the main findings from the report on financial mechanisms was that most of the European member states said that the national vaccination schedules were entirely funded by the national or subnational governments. And they actually said that the financial mechanism of vaccine procurement seemed to function well in general. And most countries used annual budget planning cycles, not long-term, which is, I think, is a key finding. It's quite short-sighted, the way they plan for the budget. But it also maybe reflects that the governmental budgets is yearly and annually is not like a strategic long-term budgeting plan in most countries. And the majority of the participants, they were also favorable to joint procurement of vaccines during serious cross-border health threats. And of course, I think they are maybe even more favorable to that part now. And they also said that other forms of cross-border collaboration, that lending and exchange of vaccines should be further encouraged. The last work on the Italian team to estimate vaccine needs and procurement in Europe, I think that what you could say that the countries who reported that forecasting vaccine demand for like annual budget planning cycles is something one could maybe look into, that maybe one should do more long-term forecasting. And most countries did not actually have written procedures for forecasting in place, and they used a combination of a size of the target population and also previous year consumption methods. And not all countries reported using electronic tools to focus vaccines. Even those tools exist, and you can readily just download them. For instance, for like UNICEF have a forecasting tool, which could be used by all countries. And interestingly, also many countries reported difficulties in estimating the numbers of individuals with chronic medical conditions for which specific vaccines may be indicated. And that is also something we're seeing with COVID-19 vaccines, particularly in the early days when we really had to prioritize very hard, and we had to figure out who were the risk populations. And at least in Norway, we really have struggled to figure out how could we identify these risk patients. By age is easy, but if you want to look into medical conditions, we have to use the GPs to identify the risk populations. But then, of course, to handle the vaccines and the risk population at the same time was quite difficult. And also the Italian finding was that vaccine hesitancy is difficult to estimate, of course. And maybe even further in the future, it will be difficult to estimate. And also vaccine wastage when you don't have like a one dose, but if you have multiple doses, then you really have to organize the logistics around the vaccination. It could be really difficult to estimate what kind of wastage do you have. And also the countries reported to interact with their night tags during focus, but it was only 3 of them who actually used the night tags. So to conclude the Italian work, I think they've really done a comprehensive view of vaccine shortages. They looked into financial mechanisms on what you need to enable vaccine supply for immunization programs. And I also think that they pointed that it should be a continued dialogue between manufacturers and health authorities, also including NITEX. And it's really needed to everybody to work along to have more accurate forecasting of vaccine needs. The recommendations and the future outlook, which we also could discuss in the panel debate, is that more research is needed on the cause of vaccine shortages and how the different causes interplay with each other. And there is a need for all countries to have an immunization supply chain improvement plan in place. There should be timely communication between the public health authorities and NITEX and manufacturers, as I pointed out. And also procurement and tender mechanisms should be improved by taking into consideration multi-source suppliers. And I think I did not mention that, but a lot of the countries mentioned that they very often only use price as a criteria for the tendering process, which of course is something one could look at. Further recommendation was a longer-term planning of vaccine demand is strongly recommended. And this is something I will come back to in the Norwegian part, but the sufficient stockpiles of vaccines at national level need to be in place, including an emergency. It was not so many of the countries actually said that they had an emergency stock for their national immunization programs in place. So this is the Italian team, and Antonetta, as Olivier said, is not able to be here today because she had a sudden loss of a mother. But you should just contact her in case you have questions to the reports. The second part of this work package was if you need to exchange vaccines quickly, what are the mechanisms we have in place and what could we recommend for such mechanisms to be in place in the future? And what we did, we also did surveys and literature reviews, and we used the workshops, and we had 2 reports. The first one was focused on understanding the mechanisms to exchange supply and demand. And we also tried to look into more depth, because that was really one of the tasks back then when we built this joint action, was the idea of having a European data warehouse where you could have the overview of all vaccines. At least you should have it like a data tool, and not, it was also some ideas to have like a physical stockpiling. And I remember back then when at least our team said this is not possible, we can't have this data warehouse, and nobody would actually want that in the future. So we will see in the future how it ends up. But I really want to point out one thing first, and I think that is really something we've seen with the experience with the COVID-19 vaccines, that exchange of vaccine stocks in case you really need supply or if you have surplus vaccines. It's not a straightforward process, and it's quite complex. It's easy to talk about, but when you want to do it in the Ministry of Health or in the National Institutes of Public Health, it's quite complex and bureaucratic. Because you need political commitment, and the member state must have in place a proper mechanism to accept the vaccines, and you need to have capacity in place to accept the vaccines. And there must be regulatory approval, because the regulatory approvals are national. It's the member states who do the regulatory approval. You need to have an import approval, you need to have indemnification in place, and also liability agreements. And particularly for emergency use vaccines, you need to have liability agreements. And these processes might seem like very detailed management for some and like a hassle, but they really must be in place before you can sign any legal binding purchase order, before you can transport any goods. So this was maybe my future outlook first. and then to the results of our task. This is also back in 2019, before the COVID-19, but back then they said in order to exchange and to ensure sufficient supply, you really need to have early warning system from suppliers of manufacturers and potential stockouts. And you need to have a sufficient stockpile at the national level, and you also need to have an emergency stockpile. Looking back to the COVID-19, we have struggled when we have the stockpile in place to actually to donate surplus vaccines when they are in place. It's easier when it hasn't touched the Norwegian ground. That's also something maybe we could discuss if you need to exchange vaccines. But of course, you need an emergency stockpile if you have wastage, if you can't, if something happens, if you need to have quickly vaccines in your own country. And in order to improve focus, this really reflects also a lot of the work by the Italian team, that long-term vaccine focus from government agencies and procurers should be in place. There should be timely input from parties. And also they pointed at harmonizing labeling of vaccines is really helpful if you want to exchange vaccines. And on the COVID-19 vaccines, there have been European labeling, so it's very easy to just switch the goods. We asked them about the preferable recommended mechanism to weight them if you want to exchange vaccines between the European countries. And it was really, they said, we want a rapid exchange mechanisms, we want SOP, standard operation procedures, and we want to have templates which could be easily just used in a national context, and harmonized labeling, and you need to sort out the liability protection. They were not so keen on the European data warehouse. They more thought, well, maybe we could just have a voluntary option mechanism. And some also pointed at the need to agreed compensation mechanisms. And specifically, when we asked about European sharing of data on vaccine supply, if it would prevent shortages in Europe, it was really like, no, yes, we don't know. But interestingly, they said that if we should have a data warehouse, they should focus on priority vaccines. It should be rarely used immunoglobulins, antitoxins, specific vaccines, and emerging infectious disease vaccines, outbreak vaccines. And back then it was Ebola vaccines. I guess if we ask today, COVID-19 would be there, or maybe future pandemic vaccines. So in the last work, we wanted to look into, because it was the task of the work package. So we had to explore further options of this data warehouse, even if the member states was reluctant to it. So we looked into if you had like three options, the voluntary sharing, the regional virtual stockpile, because we had experiences with the Nordic countries sharing data, or a virtual European data warehouse. How could it look like? And we also followed the ongoing discussions between the European member states in the Health Security Committee, because they worked on standard operating procedures and also simple exchange mechanisms. So this was back then. And what we have designed is a kind of a framework for if we want to take this further in a joint work. We really need to look into the different options. What could the voluntary sharing mechanism look like? What could be the functionality? What kind of agreed mechanisms and existing systems and templates must be in place? What would be the scope? Should it be the scope which was identified back then? Should it be more on surplus vaccines? And also the risks and legal liability. And if you move further to sharing data, you also have to handle information security, and you also have to handle GDPR and liability in a more extensive way. So our recommendation is, it might not look like this, but this is really the nitty-gritty details you have to look into in the future. So what could we conclude, and what is the added value of this work? We believe this, at least we have a better understanding of important mechanisms to ensure sufficient supply and size of stockpiles. We know there was uncertainties in the European member states and their opinion on the need to share data, and analysis have identified future options. And we also think that maybe in the future, the countries will be looking more into pandemic preparedness, vaccines for epidemic outbreaks. And that is also something which HERA is setting up at the moment. So we recommend further work on sharing data information on vaccine supply. We actually say that we were really uncertain to have a data warehouse. You should actually say that maybe we should just have a status quo and and work further with the experience we have on the COVID-19 sharing mechanisms, but really focus more on using the harmonized labeling of vaccines as a useful tool for all vaccines in the future, and to develop a standard operating procedure which all member states could use and share. Finally, we also think that the common procurement of COVID-19 vaccines has additionally provided the member states a lot of experience with sharing mechanism for surplus vaccines during an emergency, because at least in these days when we have a lot of vaccines, it's a surplus vaccines, it's a portfolio of vaccines. There are different vaccine schedules in the different countries, and also different ways to handle them. But we have now experience with the global sharing mechanisms, the global collaboration with COVAX, which has been very difficult. It had actually been more easier for the countries to put in place bilateral donations and procedures between countries to accept the templates and liability agreements. But I think that global collaboration COVAX has been improving and improving as they have gained more experience with that. And I think that these new experiences will affect the member states' view on these questions. And I think that our results should be considered in this context as well. And this is the team from Norway. And this is just a name. So I just say thank you. I think that was my presentation. And